guys, welcome back to No More Cavities. Today we will be discussing different type of fluorides. So the first type of fluoride is systemic fluoride. Systemic fluoride includes a lot of different things such as salt, milk, mineral water, chewing gum, fish, tea and fizzy drinks. So the water should contain optimum 1 ppm of fluoride. And salts decrease 50% of caries, and milk decrease 15 to 65% of caries rate. Mineral water contain 0.0 to 2 to 10 to 13 ppm of fluoride. It means they decrease 46% of the caries rate. Chewing gum 0.25 mg fluoride is present per stick, and other types are fish, tea and fizzy drinks. The next source of fluoride is toothpaste. A toothpaste should contain 1000 to 1480 ppm fluoride. A child should not use greater than 750 ppm of fluoride because it will lead to fluorosis and it will increase the chances of ingestion. So a child should use less than 750 ppm fluoride. If a child is caries free, then he can use 500 ppm of fluoride. If a child is young, less than 6 years, but have caries, and if a child is at high risk of caries, there are two types of children. One, if a child is less than 6 years but have caries, and if a child is less than 6 years but is high risk of caries, then what we will do, we will give this patient 1000 ppm of fluoride, and in this patient we can use 2800 to 5000 ppm of fluoride because he is on high risk, so we will give high concentration of fluoride. And other source of fluoride are gels. Gels are given in the form of tray or in the form of brush. We should not use more than 2 milliliter per tray. The gel contain 1.3% of the fluoride, which means 12,300 ppm. It decreased 26% rate of caries. Gels are divided as professional use and in home use. The professional use gel should contain 12,300 ppm, but the home gels should range from 1000 to 5000 ppm. The home-based gel decreases 16% of the caries rate. The gel should not be used in less than 6 years child, and you should spit after 30 seconds applying the gel. And the fourth is fluoride mouth rinses. The fluoride mouth rinses are divided as daily rinse and weekly rinse. Daily rinse contains 0.05% of the fluoride, while the weekly rinse contains 0.20% fluoride. 0.05 means 225 ppm fluoride. 0.20 means 900 ppm. Then comes the fifth source, which is fluoride varnishes. Fluoride varnishes contain 22,600 ppm. Varnish is a source containing a lot of fluoride. Up to 6 years, we give pea-size varnishes to children. There are less chances of toxicity in varnishes as compared to gels, and they decrease 50 to 70% caries. But there is a problem with fluorides. They contain a material known as colopheny, which have high chances of sensitivity. So, fluoride is prohibited in patients of asthma, atopic children, and those who have allergy to elastoplast, because elastoplast also contain colopheny. So if they are allergic to elastoplast, it means they are also allergic to varnishes. The last source of fluoride is slow fluoride releasing device. Slow fluoride releasing devices are basically made to target high risk patient, high risk caries patient. Why? Because they will continuously release fluoride. Example is GIC. These slow releasing fluoride are intraoral devices which are placed in mouth so that they can continuously provide fluoride. And other thing that releases fluoride is casein, phosphopeptide, amorphous calcium phosphate. What is this? So, as we know that the calcium and phosphate are present in the tooth structure and stabilize our tooth structure. So this casein phosphopeptide amorphous calcium phosphate, what it do? It stabilize the calcium and phosphate in our teeth by the action of serine phosphorylated group. The serine phosphorylated group present in casein phosphopeptide amorphous calcium phosphate stabilizes the calcium and phosphate so they remain for longer time in our tooth. They create supersaturated solution of calcium and phosphate which promote enamel remineralization. The casein phosphopeptide amorphous calcium phosphate is retained in oral cavity to 3 hours. So, these were all the sources of fluoride. Thanks for watching.